you hit on so many good points.
Yeah.
Man. We could go on about
On and
that.
on, man.
And you know, it's yeah, I laugh about it because it's the truth, you know,
Mhm.
and in a lot of ways it's sad, you know, but and how you and I we talk about this too, that we do need more um, you know, African Americans in healthcare administration, female or males, because I know we
Mhm.
said this, right? When we would sit in these executive meetings with the CEOs, COOs, CFOs, and executive directors and all that, I just can't help to look around the room and be like, man, I'm the only black dude
Mhm.
sitting at this table, you know?
Yeah.
And it's just like, where are my brothers and my sisters, you know? And it's just, you know, one thing that I just can't help but but to see. And then another thing too about you know what I didn't like about being a healthcare administrator is that when it came down to organizations recruiting physicians, and you know off the bat, oh, this physician is going to be a problem, right?
You still
But
hire
they still hiring,
them.
but because they know the money that this physician is going to bring the hospital, it's like, well, you know, let's try to deal with it, basically. And then the physician comes and starts problem, right? The physician don't I mean, they basically not a team player. They don't want to, you know, do any of the initiative. They don't want to sign off on their chart. They know this. And then this physician still throw the administrator under the bus. And then you become a
No.
casualty. It's like
It's over
what?
for you.
I know.
Like, and that's why I said about babysitting. Like, you'll
It's
send us an
crazy.
email like, "Oh, please make sure all providers clear their sign their notes, enter their charges." And so, what am I supposed to do? I cannot force an adult to do
Yeah.
something they don't want to do. And the
Yeah.
leadership, they hide. They put this on you. And I look at
Yeah.
it like, the last time I checked, the providers report up to you. I have
Yeah.
my staff. I had a staff. I've had a staff before. When I was in DC, my whole team, it was 125 plus people.
Mhm.
And of those 125, 60 of them probably were my direct reports, between staff. And when it came to making sure training was done, certain things were signed off and they were off lists. I took on that responsibility and I made
Yeah.
sure that happened, as
Yeah.
well as the other half of the team that didn't report to me. But what I hate is the lack of support. With all the factors that you know that this
Mhm.
person is a problem before they even step foot in the door. And we never we pick and choose who we hold accountable.
Oh
We
yeah, of
pick and
course.
choose who we set the expectations for out of the
Yeah.
gate.
Yeah.
And it's just, transparency is definitely a bad. There's
Yeah.
a lack of transparency
Yeah.
in healthcare. No one's going to be transparent with you, so it's a
Mhm.
lot, man. Yeah, I love it.
Let,
I love
and
it,
let me
but
tell you, even better, right? So an organization hire a physician that they know is going to be a problem, right? And you know when the physician come on board, not being a team player, and then what they do, they basically will try to kind of pacify the provider, right? To where and then that physician will will say, you know what, I'm going straight to the VP, you know, because they're upset about something in the clinic. So then they go to the VP or to the CEO of the hospital, make a complaint. The CEO comes back and report back down to the VP. The VP contact you, hey, you know, Doctor such and such, you know, called me and said whatever, right? And then you're talking to the VP like, yeah, I know. I mean, this is what all doctors are supposed to do, right? This is an initiative. This is what we're supposed to do. Yeah, okay, well, don't worry about it. Let me talk to Doctor such and such. So then when they do talk to doctor, to whoever, the VP be like, yeah, okay. I mean, basically they just listen. They let the provider vent, and it continues on, right, for a couple of months. And then eventually, yeah, you know, Renee, I don't think this is gonna work out because, since doctor came on board, uh you know, the relationship with you and the doctor just haven't been there. You're like,
Like
what?
what? What about my other 50 providers that love me? What about the fact that you never had these problems with me
Oh
before
my
this dude got here?
gosh.
And
Yeah.
it's crazy thing. So when I was at the University of Florida, yes, I'm gonna name drop on this because that actually happened to me. Had this
Oh
bad provider.
man.
I'm not gonna put his name out there, but
Yeah.
he ultimately he came in. We knew everything. It's so funny you brought this up. We knew he was a problem based on the referrals and the feedback we got, but we were trying to build a program, a
Yeah.
vascular surgeon, and they hired him. And I had no support. This guy
Hmm.
was ran amok. Quick story. So we had my surgery scheduler in the clinic who controlled his schedule for the OR. So he canceled a case because he got
Hmm.
another patient that walked in and he wanted to do that surgery in the cath lab and
Yeah.
bump the patient back in the OR so he could knock out the money aspect of it. So
Hmm.
he removed the case around. Luckily for us, the OR and their scheduling team created a new rule that if someone from the office, the provider, anyone from the team called to do any modifications to a scheduled surgery, that they
Hmm.
would write down actually who called, not just say on behalf of Dr. Such and such, but write down the person who called, time they called, and what the actual switch modification was. So
Hmm.
I go up to the OR. I had built a great relationship with them, and luckily, when I went up to the scheduling team, the director of the OR was in there. She was a nurse, and she really didn't like all these surgeons either. So it's all about building great relationships,
Yeah.
to get what you need. And she
For
looked it
sure.
up, and it was in the log, and she was like, "Oh yeah, Doctor Such and Such changed this case." I almost said his name, and I was like, uh, "Okay, but which one of my schedulers called?" She was like,
Yeah.
"No." She showed me the log. I said, "Would
Mm.
you be willing to send me a screenshot of that log, and can I put you on an email?" I did all
Hmm.
of that. She even responded on the email with my leadership on it. Do you know my leadership's response to me was, "Well, Dom, did you try to have a conversation with Doctor Such and Such and try to trigger his memory that
Yeah.
maybe he had did it?" Wait, he just
Hmm.
yelled at my staff member,
Yep.
like crucified her. She's
Yep.
crying. I got to deal with that. I got to
Yep.
put my psychologist hat on. He yelled
Hmm.
at me, which I
Hmm.
don't take lightly to another grown man
Hmm.
yelling at me ever.
Yep.
But for the sake of getting the patients taken care of, I bit my tongue. Like as an administrator, get used to not having a tongue because you're going to chew it off. You're going to
Hmm.
be disrespected at that level
Yeah.
in the corporate world, and it's sad. But I'm glad we're having this dialogue. It's something that needs to change and really
Big
quick.
time.
So we went,
Yep.
yeah, we went through that, and I had all my proof, everything lined up, and for that to be their response, and it wasn't maybe a month later, if that, I had that exact conversation. Well, this
Yep.
is not working out, and all because of and I asked my leadership when they, decided to let me go, what did you do? And
Mm.
when you ask them those questions, no
Yeah.
answers. They just,
Yeah.
man.
A lot of times, so this is exactly what it is because when those physicians have so much influence in the company, those, yeah, I mean, your leadership, they're watching out for their job too, right? So they're gonna, eh, you know, unfortunately, again, it's like you are the scapegoat. So whenever you are the man in the middle between
Mhm.
the providers and leadership, you are an easy way out, and that's just the unfortunate thing. There's some leaders I've had who, I mean, they were just great people, but then there's, I would say, there are more leadership that was just scared to put their foot down and be honest with those type of providers. I've had, unfortunately for me, I've had a lot of those than those that were courageous enough to put their foot down and say, "Hey, this is what it is. This is what we're supposed to do." Because at the end of the day, to me, it's about morals. And yeah, I get it. This physician surgeon brings millions of dollars, but at the end of the day, it's, at what cost? And well, I guess
Mhm.
it's the cost of the healthcare administrator job a lot of times,
Mhm.
unfortunately. But I think a lot of people really need to know this because this is the raw, uncut truth
Oh
that a
yeah.
lot that a lot of organizations won't tell you. I mean, at the end of the day, they definitely put a lot of, you know, they put um, you know, they'll say, "Hey, this is our company culture and all this stuff," but I mean, when you're really in it,
It's the total
yeah,
opposite.
it's
It's the
different.
total, and they don't. And let me add this too, man. When it comes to value, I'll tell you. So providers are they usually not. They already get huge salaries, and
Yep.
then so do administrators. But on top of that, providers based on their contract, a lot of times they get quarterly bonuses, and
Yep.
a lot of what that is tied into is the production, the revenue they bring in. When
Mm-hmm.
I got when I was in DC, I started a position. I started in January of 2018,
Yeah.
and before the end of February, and I know I shared this with you before, I found $2.7 million
Wow.
worth of unsigned notes, unentered charges that weren't entered,
Mm,
dirty claims. And
yeah.
I'm looking at this like, wow, you all, and the providers have been paid out their bonus. And your
Wow.
bonus is paid based on the revenue you bring in. But as
Yeah.
we all know, if the note isn't finished, that's lost revenue. It's sitting out
Mm-hmm.
there. And did I get anything for that? No. And the reason I bring this up is because certain individuals are valued and certain aren't. You spoke of earlier, and I know you've been through this because we talked about it, of being in meetings in the boardroom with the C-suite.
Yep.
And how many times have you been in those rooms and a topic comes up and you're the only one who can speak to the topic?
I
You're
know.
driving the meeting and you're leading the
Yeah.
meeting, but then you look at it, and I know you don't get into your field just for money, but we all work to provide for ourselves, and we want to
Mm-hmm.
make a lucrative salary.
Mm-hmm.
We want to do well. So when it comes to value, I want future administrators to have an understanding of this. In the corporate world. In If I worked at McDonald's and I was the assistant manager and I had the actual store manager, the store manager of McDonald's may make $80,000 a year. I know there are those out there that make more, but I'm gonna keep the number simple. That assistant manager is probably making somewhere between 65 and 75,000, more than likely, at
Mm-hmm.
least 60, 75, about 10 to $15,000 difference, right?
Mm-hmm.
In healthcare administration, everyone that I've reported to has exceeded my salary by six figures.
Mm.
But a lot of your work you put off on me. So
Yeah.
when it comes to my value, when you think about it, my next natural progression should be into your role. The
Yeah.
company's not gonna both give me your role and then bump me up 100 grand. They're not
Right.
gonna do that.
No.
In our
No.
actuality, what'll happen if I do get a promotion? They'll bump me up anywhere between 5 and 20%, depending on company bylaws. But if they brought an
Mm-hmm.
outsider in, that outsider would be able
Oh.
to negotiate their
Oh
contract.
my God.
So
Man. Oh my
it's. I
gosh.
mean, it's just so. I mean, I've had
You're
times
speaking the
before where
truth.
where I found out, hold on, wait a minute, I got more than this person. I more experience, more education, more
Yeah.
this and that. How was this offer? And then I tried to negotiate, and I was told this is in line. This person's making more than me, or you're paying this group of people this, and they're doing the same job and the same title. And it's
Yeah.
always, well, we don't. What's negotiated is negotiated, and we don't change. Boom, 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 boom. But I look at the
Mm-hmm.
way I'm performing, the results I'm getting, the workload you put on me. I've always, since I became an administrator, but my whole life, I always outwork everybody around because I
Mm-hmm.
work very fast.
Yeah.
So where others get stuck and they're like, "Oh, my work is piling up," I'll have more of a workload and clear mine out much faster. But this
Yeah.
is the person you value. This is the person you're paying top dollar. This is the person. And every time I look up, they're crying in meetings. They're frustrated.
Yeah.
They have to take
Yeah.
sick days off, and I'm like, this job is not even that hard. But this is the person that you value, and this happens a lot in our. Nobody respects our profession. Everyone thinks they can do an administrator's job, from the doctors to the nurses to the everybody just thinks they can be an administrator. So if I knew what I knew now, Rene, to be honest with you,
Yeah.
I probably wouldn't have gone. I chose this path. But then again, I say that reluctantly because,
Yeah.
again, I don't want to. Earlier, I did say when you get into the entrepreneurial arena and doing healthcare administration, it's very rewarding.
Yeah.
And the reward goes way beyond the lucrative aspect of it. It's actually, like what you're doing yourself. Like, yeah, you're helping providers, but you're really helping providers, like changing their
Yeah.
lives and getting them to see
Absolutely.
you can do this on your own. You don't have to go
Absolutely.
align yourself with corporate America. So
Yeah.
and that's what I admire you because everything you've ever embarked on, and I'm the same way. Yes, I want to make money. And we all want to make money. Let's just get that out of the way. But we also want to do something that has that heart element,
Yeah, passion to it.
that
Yeah.
passion, definitely. And that's something that's a need, and that's giving
Mm-hmm.
back to people, and helping other people, is such a beautiful thing, man. Like what you're doing, getting your providers with efficient scheduling and helping the communities they serve, have access to quality care,
Yeah.
by revamping their scheduling model, and actually giving them certain appointment types, and just teaching them how to go about having great customer service and patient experience, and marketing the
Absolutely.
right way. So I mean, that's what it's all about for me, man. And that's why I love this field, is because I've been able to help so many people, and the good has outweighed the bad.
Yeah.
And the bad for me is honestly my own doing, bro. Fear.
Yeah.
You cannot be fearful, man. We
Yeah.
have too much knowledge, man, and it finally hit me, man. You sit at the table with CEOs of large corporations, and they look to you for
Mm-hmm.
answers and knowledge,
Very.
bro. It was one time I walked into a meeting, I was late. I didn't even
Yeah.
know the meeting was on the books. My nursing manager, my colleague, she called me. She was like, "Are you coming up to the meeting?" The meeting started at 8. It was already 8:30. They sat around that table for 30 minutes waiting for me to get there so they
Oh
could
my
start the meeting.
gosh,
When
man.
I tell you I was pissed, in the beginning of my career, things like that was
Yeah.
rewarding. I was strutting. I'd be like, "Yeah,
Yeah.
see, I'm the
Yeah.
man." Blah blah blah. Now
Yeah.
I'm at a different level. It's like, "Hey, pay
Yeah.
me for my time. Value
Yeah.
me.
Absolutely.
You wait 30 minutes. Clearly you have time to wait around for
Mm.
30 minutes,
Yeah.
for me, so we can start a meeting. But I'm not compensated like you are. I was reporting to
Yeah.
the VP, and I'm making like right at six figures, and she's
Mm-hmm.
making like $400,000. Like, I mean, come on,
Man,
man,
it's crazy.
it's crazy, man.
It
It's
is.
crazy, and she couldn't do anything without me. And it's
Wow.
just a head scratcher, man. I was
Yeah.
the only one with the title of manager, reporting to the VP. All my colleagues were senior directors and everything like that, and it
Right.
was a struggle, man. And then you mentioned, for all my fellows out there,
Mm-hmm.
we don't dominate this field, man.
Yeah. 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 We
And,
don't. We
and
don't.
so while I've also been a one of one as far as my ethnicity, a lot
Yeah.
of times I've been a one of one as far as my gender, and
Mm-hmm.
being much younger than my colleagues and being a male. Oh my God, it's been tough,
Yeah. It's
sitting at the table. Yeah.
yeah. No. Go ahead. Go ahead, man.
No, I'm just saying, sitting at a table that you're not really invited to, if that makes
Mm.
any sense.
Yeah, or you may be invited to, but just because you're invited doesn't mean they want to hear you speak either. You know what I
They want
mean?
you to
So
operate in that box. Stay in
yeah,
these
yeah,
lines, brother.
for sure, for sure. But you know what, you mentioned something too, because um because one other question I have is, if I could do it over, what would I do different? And so for me, I think about um healthcare administrators that are coming, you know, or that are in school about to finish, and they get into
Mhm.
a residency program. And then that residency program can be, I don't know, anywhere between 2 to 4 years, maybe, depending on which program. And a lot of times they're with, large healthcare systems. And if you do a really good job, then they basically place you in some type of executive, VP, president, or CEO role. So check this out, right? So you go to school and you do all the didactic portion of the field of healthcare administration. And then you go do training for 2 to 4 years. But these training are such on a high level that you really don't know or don't fully grasp the
Day to
day-to-day
day operation.
operations of things, right? But you understand the system approach, how things should work. And that's fine, that's cool. But kind of what you alluded to, Dom, right? You have a VP, cannot do much without you, and they depend on you because you're leading that day-to-day operations, right? You know the inner workings of your practice, how things should work, the positions or whatnot. And the good thing about being a healthcare administrator, you learn to understand how things should work. But going back to what I'm talking about, to where, from school you get into a residency program, and then you get put into these CEO VP positions, which is great, it's cool, but here you are, working in these large organizations, and you're at these meetings with the C-suite all the time, but you really don't know the inner working of the operational aspect of things. And so it goes to go back to, you have a lot of people who are in these type of role, and then I'm gonna tell you, I'm not gonna say no names either, but a company that I worked at, we have, on the physician group side, we had a VP. I don't know if he's still there, but he used to always say, like, whenever all the clinics, support staff, he would bring them, and basically, we would have a meeting, and he'll say, hey, um, exactly where you guys are sitting at, I used to be in your position too, from desk to practice manager to you know area practice manager, market manager, then I just move up the company. And basically he was trying to let people know, hey, if I were in your, if I was in your shoes before, you can be in my shoes later on in life. But he didn't tell you the whole story. And this is where, um it's nice to have a family member who's up there in the company to get you to where you are, because what he failed to tell people is that, oh, my father-in-law is, like, one of the presidents of the company, you know what I mean? And when you look at his resume, yeah, he put you to work in a clinic as a front desk for a year, and then from a year you go to being a practice manager, and then after a year you go to being a market manager, and then after a year you go to being a director of operations. It's like, sheesh, I
In
mean, you
five
get
years.
promoted
In
pretty
5 years.
fast, you
Yeah,
know
yeah.
it.
And then they look at you crazy when you ask a question about it. Like it's
Yeah,
crazy.
yeah, it is like, man, it's either I'm doing something totally wrong, because your promotion is, I mean, you setting records, you know what I mean? But um what do they call it, with nepotism, right? You know what I
Yeah.
mean? So, and I mean it is what it is, it happens, and for him now, don't get me
But it's
wrong, he
wrong,
under
man. It's wrong, man.
yeah,
It's so wrong because, and I hate to cut you off, but it's wrong because all in our field, the patients suffer because now the person calling the shot
yeah,
they don't have that, like you said, that ins and outs. And I'm not hating or anything like that. It's just like you said, paint the picture accurately. You spoke
mhm,
of earlier people doing internships. At my last job, man, I inquired a couple of administrators. We wrote the CEO collaborative message, basically saying, is there talks about creating this internship program for internal people who are already here?
mhm,
Because what's happening is we have experience and you're taking someone fresh out of college and you're putting them through this rigor and you're saying to us, yeah, but we put them through the fire for 2 years, high level projects, this, that, and all of that's great. But my response to them was, what do you think the end result will be if you take someone with experience and understanding and put them through that fire for 2 years?
yeah, yeah,
And what I've learned, man, is they don't want that because they know you're going to come with a thought process that comes from the ground level and
mhm,
tie it into the business aspect. So they know that you're going to understand both worlds. And a lot of times in this field, man, intimidation is a real thing. They try to intimidate you with their title and the position they're in. But the real intimidation is they're intimidated by the knowledge you have. And it took me a
yeah,
while to learn that and accept it, man. And it's wrong, but it's the world we live in. And brother,
yeah.
I could be as passionate as I want about it being wrong, but that's why we got to do what you're doing and create our own.
Yeah, it is what it is, man. But I'll say this about the residency program. I think it's a great route to go. I
Hmm.
think, we definitely need more people of color to go through those residency programs. But It doesn't matter how high you get up the ladder. Make time to, get down to the people who are actually doing the work. Make time to understand the operation. Because let me tell you, there's no greater respect than getting the full respect and support of the people who are doing the work day in, day out, especially, when you round on them, you check up on them, and you really make yourself personable, right? Because I get it, when you get high up in those positions like VP, executive director, or whatnot, your time is limited because you're constantly in meeting. You may have to do a lot of travel or whatnot, but being able to make an impact, to just pop up in clinics and just spending some time with support staff and visit providers, I think it makes a big difference for sure. So, my last question, because this conversation, man, I know we can go on and on and on about this, man. We can just hit on so many points, but I'm pretty sure whoever is considering to get into this field is really gonna find this insightful. And not trying to scare anybody, but at the same time, we
No,
wanna be very honest about it too, right? But what
wish somebody
advice?
had told us this.
Yeah, yeah, exactly, right, exactly. But what advice would you give anybody who is thinking about becoming a healthcare administrator?
Um, I would definitely, because of the setup, will piggyback off of what you just said. Definitely, if you could get a residency, get it. It'll jumpstart your career.
Mm-hmm.
You will miss. You will skip a lot of steps.
Yeah.
And it just catapult your career in a way that's so beneficial to you in the end. But at the same time, if you do skip those steps, make sure you go back and you learn the operations. If you're someone who's fortunate to climb the ladder, make sure you understand what the people that report up to you. Uh, Ensure you understand what they do,
Yeah.
and let them know that you appreciate it. Appreciate them not just by your words, but getting down on the ground level and spending some real time with them and taking notes and going back to fight for those things and those resources that they actually need, not just based off of what they're telling you, but based off what you saw as a senior leader and now going to use your platform. As an entry level person, having an understanding that building strong relationships with your providers and your leadership is going to be key to your success. Because I've found that building relationships with the patients and your staff is much easier than
Mm-hmm.
building a relationship with your providers and your leadership. So if you can build strong relationships with those individuals, you'll be very, very successful.
Mm-hmm.
Because even we talked a lot about providers, but you said something earlier. Even if you have a crazy one, if they love you, you're gonna be
Mm-hmm.
all right. I've
Oh
had those
yeah.
crazy ones who have a lot of clout and they just love me.
Oh
So
yeah.
they'll go to war with leadership about me. And leadership
Oh
is
yeah.
so terrified of them and want to please them that I've
Yeah.
been able to benefit from it. So build great relationships with your providers, even the crazy ones. Like get them on your side. If you can do that,
Absolutely.
you a lot of the stuff we talked about today, you won't
Mm-hmm.
even go through it because
Yeah.
of that. That's a key piece. Definitely I know I said earlier about
All right.
so yeah, just make sure you build great relationships with your providers. Do your research. If you're someone who has a clinical background and you don't absolutely hate the clinical aspect of healthcare, consider
Mm-hmm.
going to nursing school. There's been so many great opportunities that I honestly think I would have stayed around in corporate America, especially the hospital setting more if I would have been a nurse. Because one of my dream goals, being a former operating room tech, OR
Mm-hmm.
tech, I would have loved to manage a ambulatory surgery center. That would have been rewarding for me just because
Yeah.
I loved my time in the OR.
I
One of the
agree.
best jobs I ever had was the job that got me into healthcare administration, being the equipment manager, business manager for the OR. So I
Yeah.
would have loved doing that, but they prefer to have nurses. A lot of my background is extensively in cardiology, cardiovascular services, and a lot of the administrators in that world, because it's such a complex specialty or group of specialties, they prefer nurses for those roles. Like I applied for a role one time to be in charge of the echo lab, and I
Mhm.
had done a lot of extensive work with echo. So being a nurse has its perks. So if you want to be an
Yeah.
administrator and really climb, the turnover is there, not necessarily turnover, but more so the growth. Along with the turnover, but definitely the growth. So there's always roles for nursing administrators, and those roles are going to be six-figure roles, very lucrative out the gate, upwards of the upper $100,000 plus salaries. So that's
Hmm.
very rewarding.
Yeah.
Over a lot, large responsibilities, large areas of responsibility. So that's definitely some advice I would give to someone is consider going to nursing school.
Yeah.
But mostly just don't come into it with your heart set on climbing the corporate ladder,
Not at all.
because that yeah, you could paint the roadmap. You're looking at two individuals who we dreamed we had our whole roadmap of how we were going to
Right.
become the CEOs of a hospital one day. And now if you ask either one of us that, we unless we're purchasing the hospital and it's going to be our hospital, which I don't have that kind of money right now, that we couldn't that couldn't be furthest from the truth, man. We don't want to do that,
Yeah.
man, just
Exactly.
because of the politics.
Yeah.
Definitely familiarize yourself with politics and knowing what it's like to be in a political environment, because healthcare is just
Hmm.
that. You have to be very political, and just research, man. Just anything you're interested in, become the subject matter expert in it. Certifications. There are a lot of certifications that are out there
Absolutely.
that will separate you from the pack, and kind of give you that leverage that you need. When when you can say you're a certified executive in X, Y, and Z, there's not much people can tell you.
All the alphabets
Um,
behind your name.
yeah, yeah, yeah. You want to have those. It's value added to your career. You get a little more respect, because people aren't going to respect you for your opinion, whether your
Hmm.
opinion is right or wrong. They're not going
Right.
to respect you for your insight, and your mindset. It's just not the nature of it. So it goes back to that first question: is this
Hmm.
everything I thought it would be? No. You're not going to have a lot of autonomy in this field, especially not initially. But yet you'll have so much thrown on you. So you'll definitely be busy, definitely have a
Yeah.
lot of responsibility, but you're just gonna have to build those relationships, because what's sold to you is not reality.
Right.
You'll think you're coming in to run operations, be the decision maker, and work with your team to change this and fix that, and it can't be, I mean, further from what the reality is that actually is, man. And it's just that when you want to make a decision, just have the understanding and respect that you're going to have to basically get permission and work with a lot of people to make a simple decision. Because
Yeah.
if it rubs one person the wrong way, and that person is a key stakeholder,
Hmm.
not only do you not get what you need for your clinic, but it's just going to be a downhill battle. I mean, because you pissed the wrong person off one time, and whether intentionally or not. So, yeah. So, in a nutshell, build great relationships. Try to stay ahead of the game. Be a subject matter expert. One of those internships that definitely catapult your career, and consider having a clinical background, going to nursing school.
Yeah.
Those are just some of the things that I've learned, that can really, someone who really wants to break into the field, especially on the corporate side and climb that ladder. Those are some things, if I could redo it, I would change a little of those things. But
Yeah.
yeah.
You definitely hit a lot of good points. I think for me, definitely recommend giving a mentor. I
Hmm.
think getting a mentor early on is will be key for anybody because you can bounce ideas off, especially when you have questions. And then as you said, I definitely agree with the residency program. It is really helpful. I mean, they will prepare you. I think in the residency program, you'll learn the politics, like you'll see it head on because you will be around it all the time. You'll see how they move, you'll see how they dress, you'll see how they speak. And not saying that you need to change who you are, right? I think always maintain your integrity. always keep your morals, but also understand what the organization is wanting you to accomplish in the role that you're in, and just go from there. For me, I've been a big believer. If something is for you, it's for you. If it's not, it's not. And
It's
whether
not.
you're in that role for a season, then get as much as you can out of that position for the season that you're in, and then move on to the next opportunity. Again, as Dom and I will tell you, is that we've gained so much, we've learned so much, we saw the good, we saw the ugly, but at the end of the day, although we've got our bumps and bruises along the way, it has made us who we are. And now, for me, I can definitely say I'm happy to have, my own company. And so I'm having fun. I'm really doing exactly. So I'll put it like this: the same passion I had when I first got into this industry is what I now have again. And so again, it's just being able to have those opportunities and experiences. But besides that, I leave it at that. And Dominique, I thank you so much for coming on Healthcare Experiences. Your insight, your stories have been valuable, and I'm pretty sure that anybody else who is watching this is going to learn from this. And just thank you just thank you for being on the show. And if anybody want to get in touch with you, what's your social media contact information for people to reach out to you?
Yes. So I'm at Dominique dot Stewart on Facebook. I'm at Dom Junior 1307 on Instagram. And if you want to shoot me an email, Dom Junior 1307 at gmail.com. And on LinkedIn, I'm Dominique Stewart. And my picture will pop up. So there's not many of us on there. So I'm definitely accessible. I love to answer questions. If you do reach out to me, just say you kind of saw me from the Health Experience podcast, and I'll definitely get right back to you. We're all in this together, man, and I just wish somebody would have did this for me. Thank you so much, Rene, my brother, for having me on. It's definitely been fun. I look forward to
Hey,
doing it again, man.
likewise, likewise. Awesome. All right. Well, thank you guys for watching Healthcare Experiences. I'm Rene Lumene, and I'll see you next time.